It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, which of course features some of the best doctors in the entire Houston area, Candace, that help change people's lives.
They certainly do. Like our first best doctor, it's podiatrist Dr. Gabriel Maislos.
Miss Gudelia Armas, she came to my office and she complained of a short fourth toe. This is a congenital deformity. We call it brachymetatarsia. And essentially, the fourth metatarsal stops growing and it's not as long as the other metatarsals. That causes a short fourth toe and a floppy toe.
When I was 10 years old, my foot started to hurt every time I used slips or like shoes. It bothered me a lot. Basically, I couldn't wear a lot of shoes or tennis shoes because it would bother me.
Cosmetically, it's disturbing, as well as it can cause problems, physically, in pain and other discomforts.
I really didn't thought there was a possibility we can do that, but when we came here, the doctor actually told me, yes, there is a possibility you can actually do it.
The procedure is done in an outpatient setting. It takes about an hour and a half to 2 hours to do, and then the patient goes home. And outside of coming in for dressing changes, suture removals, most of the work is done at home and just involves turning a knob 4 times a day. It does require compliance, as far as not excessively weight bearing and really risking injuring the operative site.
It's been 8 months since the surgery and I've been able to run better. I can walk faster. I can do a lot of stuff now since it's over.
The procedure itself is not painful, but it does take time. We can't make bone grow overnight. So it can take 2 to 3 months, but in the end, it's really, dramatic results, which you can see from the x-rays as well as the pictures for Miss Armas.
It's better because I can run better, I can wear my shoes more comfortably. I don't have the feeling that, I can't wear my shoes because it's gonna hurt. It's really better. I can do a lot more things than before.
Jean had some small breast tumors that didn't show up on her annual mammogram, but thanks to Dr. Rose, his 3D imaging was able to detect them. To hear more about Jean's story and other life-changing stories, log on to bestdocsnetwork.com.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth. And George is a very outgoing person and likes to smile and has a great smile. And so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and complete it in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
All of the doctors featured on our show are all about changing people's lives. Like our next doctor, it's ENT, Dr. C.T. Nguyen.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, you know, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. You know, everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you know, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, you know, I'm able to do things without getting winded, you know, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a center of excellence in nose and sinus disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
A lot of people take aspirin. As physicians, we've asked people to take aspirin for many years. For a while there, we told every man over 45 and every woman over 55 to take a baby aspirin every day, 81 milligrams. we were thinking it prevented heart attacks and strokes, and it does, but also at the risk of some other problems, bleeding, for example, gastrointestinal bleeding. Now we feel that aspirin should be used to prevent heart disease and strokes, mainly in people who have other risk factors such as hypertension, diabetes, cigarette smoking, obesity, or a family history of early heart disease. If you are one of those people, then aspirin may be right for you. Now, if you take aspirin, you don't want to take a big aspirin. 325 milligrams is an adult aspirin. Just get an 81 milligram aspirin. That's a baby aspirin dose. Now, don't buy the baby aspirin. It's flavored. It's expensive because of that flavoring. Just get an adult aspirin that's 81 milligrams. Now, some people get heartburn with aspirin. If that's the case, you can use what's called enteric-coated aspirin. This is coated so that the aspirin dissolves not in your stomach, where it can cause irritation, but it dissolves further down in your small intestines. 81 milligrams, again, is all you need. Just ask your physician. He or she can tell you what's the best dose and whether you're the right person to take it.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varughese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and it had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varughese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Because of my history and being out in the sun a lot and not using sunscreen and not using glasses, I knew that I needed to do something and do a little bit as you get older. Then you're not dealing with a big mess when you're 60 or 70.
Due to her career that she worked previously, she enjoyed a good life where she worked at Club Meds around the world, but obviously you're going to get a lot of sun exposure, and with that sun exposure comes changes and disorder in the collagen and the pigmentation of the skin. You want to rejuvenate that skin, and then you want to protect it from further damage, and then you also want to even out the tone to kind of correct some of that sun damage that she's occurred over the years.
I came over and I talked to Dr. Bancroft, and he said, I really think that my new cream that I've made in my compound pharmacy would really, really help you.
In terms of the skincare products that we have here, we have basically a compounded cream where we're basically taking the cream and adding into it specific levels of the active ingredients for each patient. So you can have someone who has more of an issue with controlling pigment or needs more rejuvenation. You can work your way up to the level of retin-A that's appropriate for that patient.
I started using the cream probably about 5 or 6 months ago and immediately noticed a difference with just the texture of my skin, the feel, the way that it looked, and the glow that it gave me.
You know, when you talk about things like sun protectant, that's the kind of stuff that's working from that point forward. But those damages that you've had, those fine lines, those wrinkles, the pigment, the age spots, those kind of things, obviously the ingredients in the skincare products we use can help even out the skin tone for that. And then the rejuvenating component will build more collagen, build more proteaminoglycans, other protein structures within the skin. As you get those built up, they allow your skin to hang on to moisture better. Skin that hangs on to moisture better will appear plumper. Skin that is plumper won't have those fine lines that people complain about, and so it really will start to freshen and turn the skin around so it can look better.
You look so youthful, your skin's glowing, and I call it the magic cream. So I let people that have asked me know that I've been seeing Dr. Bancroft and that he has this wonderful cream that I call the magic cream that has worked magically on me. And several of my friends have come here and are using it and have noticed a great difference as well. So it's a lot of fun.
Don't forget, for more information on any of the doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com.
That is the place to go right now, Candace. The place to go is our next best doctor. It's gynecologist Farhina Imtiaz.
Colleen had a robotic hysterectomy. She had abnormal bleeding after menopause, and that is always a very worrisome sign if a woman experiences.
My cervix was very thick, and above all my symptoms, and because of my age, you know, I'm 62 years old, so it was time.
Now Colleen was potentially a case of uterine cancer, so I decided to do a robotic hysterectomy on her so that if we needed to, we could continue after the hysterectomy looking for cancer in other places.
I was very impressed with Dr. Imtiaz when I came into her office and her staff. They lined all of my appointments up for me. I just couldn't have been happier with her. I knew as soon as I met her that I was going to be in good hands. She explained everything great.
Robotic hysterectomy I usually do for patients who may have other conditions that preclude them from having a routine laparoscopic hysterectomy. Some of these conditions could be a very large uterus, or if we suspect cancer, or if the patient has had multiple abdominal surgeries and we are suspecting adhesions or scar tissue inside the abdomen, or in patients who are overweight.
When I get up in the morning, I think to myself, I just have so much to look forward to because I don't have that pain, that misery, and I have a lot of ambition right now. I mean, I'm able to do a lot more things, and I'm not constantly thinking about, oh my God, I don't feel good today.
You know, as a gynecologist, as a surgeon, it makes my day when I see a patient get up and walk out shortly after her surgery. I think it's silly to have somebody bedbound for 6 weeks, not be able to walk around, not be able to take care of her household, when the answer is simple. I know that I can get them up and about and moving and back to their life immediately.
On a day-to-day basis, I was experiencing chronic pain, chronic migraine all day, 24/7. I'd wake up with one, I'd go to bed with one, and it would never go away. I tried everything from acupuncture, a chiropractor, nerve blocks, spinal tap, and there was no relief with anything.
When Jennifer first came in, she was 17 years old, had been totally debilitated by her headaches, had been basically housebound, was homeschooled, hadn't been able to do all the normal stuff teenage girls do during high school, just because of her chronic daily pain. And so we decided she was a good candidate for the trial, and then when we did the trial, when she came back several days later, she'd been almost essentially pain-free from the time we put the trial in to when she came in to take the trial out.
The 5 years I experienced chronic daily migraines, I was completely limited. I couldn't do anything, stuck at home, dark bedroom, cold room, the typical, I've got a migraine, don't talk to me, irritability, everything.
We've been using stimulators for chronic back pain for 30 years or so, and Dr. Reed decided one day somebody with headaches to try putting a stimulator over the peripheral nerves that supply around that scalp, and the patient had really good relief, and that's how it all kind of got started. Now to have a procedure that gives people either complete relief or 80–90% relief, that was real dramatic, and that was, just the stories you get back from patients was what makes it worthwhile.
I can do anything. I feel like I can experience anything. My pain isn't holding me back. I'm, going to school, experiencing life to the fullest as where I wasn't before. The neurostimulator completely gave me my life back. My life has completely changed. I've done a 180, and I feel that I can experience anything because I'm pain-free.
Don't forget, for more information on any of the great doctors you see on today's show, head to the website. It's bestdocsnetwork.com. Right now, time to head to our next best doctor. It's bariatric surgeon Dr. Robert Marvin.
I had the gastric sleeve. It's where they go in and they remove about 2/3 of your stomach, and it didn't involve any rerouting of the intestines, which is what I really liked about it, so I didn't have malabsorption problems. Went in one day, did it, stayed that night, went home the next day.
The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. So it avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. A lot of patients feel comfortable with it. They know that there's not something that probably may have to be taken out later on. The weight loss is very good. It's comparable in our patients to a gastric bypass, probably within 5% to 10% weight loss compared to the gastric bypass, which is the gold standard.
Last month we went on vacation. We were gone for 12 days up to the East Coast area. We walked through the Arlington National Cemetery, which I wouldn't have been able to do a year ago.
The operation, we like to say, is not an end in itself. It doesn't take care of everything. It won't lose weight completely on its own. But what the operation does do is it gives the patient a lot more control than they have before the operation. If you do the things that you've been trying to do to lose weight, if you exercise fairly regularly and consistently, even if it's not a lot, you will lose a lot of weight. If you eat right, if you decrease the percentage of carbohydrates and fats in your diet and increase the percentage of proteins and limit the total number of calories, you will lose a lot of weight. It makes the good behavior a lot more successful than it was before the surgery.
First of all, it's a tool. It's not a fix. Dr. Marvin and his staff will get you there. They will walk you through it. Make sure that you are taken care of, that your needs are met too. And that's what's so great about Dr. Marvin and his staff. It has made a tremendous difference in my life.
I am an athlete.
I am a World Series champion.
I'm a hockey player. I'm a football player. I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test and you could save your life or someone you love.
Get screened. Be a part of 1 million strong.
Well, from the standpoint of non-invasive treatments to the face, such as the Botox, that helps reduce the wrinkles. So you want to prevent them before they actually establish them themselves long term. So that's what the Botox is going to do. It's going to paralyze those muscles that cause the wrinkles. Therefore, you don't get the wrinkles.
Botox is more for like the fine lines that I have around my eyes or my forehead, or especially, in the zone where we make the little snooty face. And over time, the creases get worse.
In addition, anybody who has the aging process, which is the natural creases or folds in their face. That's where the filler can come in.
The filler, I come in for my lips, just to soften the area right here where it starts to wrinkle. That didn't happen until after my mid-30s. I started getting a little fine lines around my lips. So she came in, it's really not to have big lips, it's just to soften this area. And in my folds right here.
There are different types of fillers on the market now. The most common is a hyaluronic acid type filler, which means it is a protein that's normally found inside the skin, and by injecting this type of filler, it attracts water to the area and therefore plumps the area out.
If I get a Botox procedure, I can come in on my lunch break. It's very quick, I can go back to work, I don't look crazy or weird.
Anybody can be a good candidate for Botox and fillers as long as they're not on any blood thinners, okay? Or if they have any allergies to any specific medications, such as the Botox or the fillers.
I believe the non-invasive route is the better route, and then if that doesn't help, then you may have to have some type of plastic surgery done. But there's all kind of things that you can do now between the lasers and the chemical pills and really good products and injectables. I believe that you can do a lot and you don't have to so far go as far as getting cut on. Mine is to really look refreshed and nice. I'm not trying to look 20, I just want to age gracefully.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We are the Babetta Lindick Breast Center at the Memorial Hermann Memorial City Medical Center, and we provide all these psychosocial services to our patients newly diagnosed with cancer to assist them through their journey.
It's a very, very special place, and it's a special place in part because we were fortunate to have a benefactor to provide us the state-of-the-art facility with the state-of-the-art equipment, but it's much more than that.
Well, in terms of for our patients who are coming in through our breast center, coming in for their screening, sometimes coming in for diagnostic imaging if they have a breast lump, following through the process, having a biopsy, they come in feeling well, feeling good, and then all of a sudden they hear those three words, "You have cancer." That can be very scary, particularly when they were not expecting this. So this is through our breast center, we have a complimentary service. We have a breast oncology nurse navigator just to meet with you, to visit with you, to be with you where you're at, to educate you, to empower you with questions.
A patient comes in and they're diagnosed with breast cancer, that's a big shock because most of our patients are very healthy. They don't feel sick. And so to get this diagnosis, it's a big trauma. Having someone who can navigate someone through this shock to get them through this in a very healthy way. And the reassurance that at the end of the day, most of them are going to do very well, and they're either going to be cured or they're going to have a very good result.
So when patients coming in with a new diagnosis of cancer, we are there to offer these comprehensive psychosocial services to assist them through this process and journey.
This center sees more breast cancer than any other hospital in the city of Houston, including MD Anderson. So it's a little known fact, but we have something to be very proud of, and both the ability to give the patients the state-of-the-art care, as well as to handle a large number of patients I think in a very caring way.
All right, that'll do it. That'll wrap up another edition of the Best Docs Network, which of course features some of the best doctors in the entire Houston area that help change people's lives. And for more information, Candace, of course, for all these folks out there who want to check up on any of the doctors you see on today's show, head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, or if you know of a doctor that's helped change your life, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.